everyone, welcome back to my channel. My name is Eva Chan and I'm a speech and language therapist. So today we're going to talk about this topic of whether or not my child has autism spectrum disorder or a pure language delay. As a speech and language therapist, I am not qualified to make an autism diagnosis, but with these many years of experience working with children with ASD and language delay, here are some of the key things or red flags that I look out for. First of all is the presence of repetitive or restrictive behavior. These behaviors are like hand flapping or spinning or playing toys in a very rigid way, like putting them in a straight line. While these behaviors can also take place in children with no ASD diagnosis, they are less prevalent in children with a language delay or a language disorder. Secondly, it's the social skills difficulty. A lot of children with autism, they often play alone and have less interest or no interest playing with their peers in a group. They also have little eye contact, whereas a child who has language delay, they often want to interact with you. When you walk in the room, they will look, they will wave their hand. It's just that they don't have the words or the correct sentence structure to communicate with you appropriately. A lot of children with the autism diagnosis, they prefer to play on their own and they do not interact or have very little interest in interacting with their peers. And a lot of them, they have very little or no eye contact when you're interacting with them. Whereas for a child with a language delay or a language disorder, when you walk into the room, they would look at you, they would wave, they would reciprocate when you try to interact with them. Number 3 is their interests and their play skills. So for children with autism, a lot of the time they have very specific interests or they have a very rigid way of playing. Perhaps things have to go a specific way and they have their own agenda. If things do not go their way, they are really less flexible to change it and may even throw a tantrum. I have a student who wants me to sit on a blue chair during therapy session, and if the blue chair is not present in the room, he would not start the session and would go around the center to look for the blue chair. And there's another student, while we're playing the number insert puzzle, he would always want to skip number 3 and number 5. Not sure why, but it's just a more rigid way of playing. So these are some of the examples that I notice when I work with children, and it helps me differentiate whether a child may have autism spectrum disorder or a language delay or disorder. If you're a parent and you notice some of these behavior in your child, you may want to speak to a speech and language therapist or speak to a pediatrician to find out more. Thank you for watching and see you next time. Goodbye.